Hi everyone, this is the immunological disorders lecture. So in this lecture, we're going to learn about what happens if components of your immune system don't function properly. So in the last two lectures, we learned about the immune system. So you learned about innate immunity and adaptive immunity and how important it is for our health. And now we're going to learn about what happens when the immune system doesn't function properly. That could mean it functioning too much, and that could also mean that it's not functioning at all, it's lacking. So we're going to learn about hypersensitivity reactions, autoimmune diseases, and immune deficiency disorders. And they're all a little bit different than each other, but they all have to do with different components of the immune system not necessarily doing what they should be. So the lecture outline, we're going to talk about something called hypersensitivity, and we're going to talk about 4 hypersensitivity reactions. We're going to talk about autoimmune diseases overall and focus on 3 autoimmune diseases. And then we're going to end the lecture and talk about immune deficiency disorders. So what happens when you're lacking an immune system. So we will start with hypersensitivity. Hypersensitivities, there are 4 different types of hypersensitivities, and hypersensitivity is an exaggerated immune response that is too much where it damages the host. So think of like too much inflammation or too much cytotoxic T cells killing cells that they otherwise should not be harming. So that's hypersensitivities. With autoimmune diseases, that's when your immune system turns on itself. Auto means self. So this is when your immune system starts directing its killing responses towards your own cells, which is not a good thing because your immune system should target foreign particles, not its own self. And then we're going to end with immunodeficiency disorder. So what happens when you lack different components of your immune system? So these are the 3 categories we're going to focus on in immunologic disorders. And now we're going to start with hypersensitivities. So hypersensitivity is an exaggerated immune response that injures our cells and our bodies. There are 4 different types of hypersensitivities called hypersensitivity type 1, type 2, type 3, type 4, and they're categorized according to how long it takes to respond and the different mechanisms. So we're going to talk about each one, but for example, type 1 hypersensitivity is an allergic type of response. This is when we think of typical allergies, like someone having allergies to different foods like peanuts or drugs, penicillin. Type 2 is called cytotoxic hypersensitivity response. And with this one, it's called cytotoxic because we see a lot of killing. Cytotoxic has to do with T cells, the T cells that kill. Type 3 has to do with immune complex deposition, and type 4 takes a while to kick in that hypersensitivity, so it's called a delayed hypersensitivity reaction. And we'll do a summary once we've gone over each one in detail. So I'm going to keep referring to this table. I made this table for you guys that has a summary of each of the hypersensitivities, and I think it'll make more sense when we go over each one. But right now we're going to focus on type 1 hypersensitivity, and then I'm going to go over it in detail. So type 1 hypersensitivity has an immediate response. It's mediated by IgE, which is an antibody. And remember, in adaptive immunity, we mentioned that IgE is an antibody or immunoglobulin that is important in allergic reactions. This hypersensitivity is quick to respond or rapid, and we see a lot of release of different inflammation molecules or precursors such as histamine. Examples of type 1 hypersensitivities are typical allergic reactions such as hives, hay fever, asthma, and anaphylactic shock also falls into type 1 hypersensitivity. So let's talk about what that is. So type 1 hypersensitivity is an immediate response to an allergen, and an allergen is any antigen that causes an allergy response or an exaggerated sensitivity to an otherwise harmless agent in the environment. That's what an allergy is. It's your immune system going crazy because it assumes that a peanut, for example, is a virus or a bacteria that's going to kill you, so it starts attacking it, and in essence starts causing a lot of inflammation and other symptoms in your body. So this hypersensitivity is called an allergic reaction or allergy. It falls into type 1 hypersensitivity. It has to do with IgE antibodies. With each hypersensitivity, we're going to talk about the cells involved, and we see an immediate response. If someone has an allergy, whether that's, think of like pollen or spring, when people go outside, if they have allergies, you can tell immediately when they come back in. Usually you see red eyes, swollen nose, lots of runny noses, so lots of inflammation here. So the response is very fast, and different substances that can trigger allergies are inhaled substances such as pollen, pet dander, mold. Lots of people allergic to different pets, cats. Injected substances, this is like drug allergies, so people who are allergic to different antibiotics. This is a type 1 hypersensitivity. Venom, this is a reason why if you get bit by an animal, you need to go to the doctor right away, because you could have an allergic response that could be very dangerous. And then ingested substances, so different foods can cause allergies in people. Peanuts, seafood, strawberries, just all types of food that can cause allergies. And again, an allergy is a type 1 hypersensitivity that's mediated by the IgE antibody. So this allergic reaction can only happen once you've been exposed to whatever it is that can cause the allergy, and we call that sensitization. So I'm going to explain it. So an allergy happens once you've been sensitized to an allergen. An allergen is whatever it is that causes you to have an allergy. So if I was allergic to peanuts, that's my allergen. If I was allergic to the antibiotic penicillin, that's my allergen. And so how sensitization happens is, remember that this has to do with antibodies, specifically IgE. The cell that makes antibodies are B cells. So B cells will multiply and they'll make IgE. They'll get activated by helper T cells, like all of adaptive immunity. They will start making IgE antibody. The IgE will go on to bind to other white blood cells, mast cells and basophils specifically, and then that antibody on the surface of your white blood cells will go on and interact with the allergen, assuming that that allergen, unfortunately, is like a pathogen. And so sensitization is when your immune system starts producing these antibodies in response to an allergic reaction. And now you have those antibodies in you, so that if you eat peanuts again, now unfortunately your body is going to go attack those peanuts and cause inflammation, cause different things that would otherwise help you if you were attacked by a pathogen. So you have a lot of inflammatory mediators released, like histamine. And then, so with more exposure to your allergen, like I said, the IgE will bind the allergen, and this will cause the white blood cell, the basophil or the mast cell. Remember, basophils are granulocytes, meaning they have different granules in them. It will release these granules. One of these granules is histamine. Histamine is a pro-inflammatory mediator, and then you get the typical inflammation response. So you get vasodilation, meaning your blood vessels dilate. And remember, the purpose of this when a pathogen attacks you is when your blood vessels dilate, you get more white blood cells, you get more removal of toxins, so it's a good thing. But here it's because of an allergen that is an otherwise harmless substance. You get fluid leakage, you get bronchoconstriction, your body starts producing a lot of mucus. This is why people with allergies start having runny noses a lot, because your body is trying to get rid of that pathogen. So this is what happens. This is with future exposures to the allergen. And so again, sensitization is the first time that you're exposed to the allergen so that you can produce antibodies against it. So you get exposed to an allergen. Let's say you're allergic to pollen. Pollen enters your bloodstream. Then your B cells get activated by helper T cells. They start making IgE antibodies. IgE antibodies go on to bind different white blood cells, such as mast cells and basophils. And now you've become sensitized. So now in the future, if you get exposed to allergens again, your body has the antibodies to fight the allergen. And in this case, it's a pollen. So they'll attach, the antibodies will attach to the antigen, which is the allergen, and they will release different inflammatory mediators such as histamine, and then you get inflammation and the typical allergy response. Examples of this type of hypersensitivity. So there's local reactions, localized allergic reactions, and there's systemic. Localized means they're in one area, systemic meaning they're spread throughout your body. And as you can imagine, a localized reaction is much better than a systemic reaction, which can be very dangerous. So examples of localized reactions are hives, hay fever, and asthma. Systemic anaphylaxis is when the reaction starts spreading everywhere, and this is what we see with anaphylactic shock, and we'll talk about these examples right now. So let's start with the localized reactions. So with a localized hypersensitivity reaction, an example is hives. Hives is a skin condition where you see a lot of flare. You see, as this picture shows, this is an exaggerated hives picture, but this is what it typically looks like. And it's triggered by foods, medicine, anything that can irritate someone. The way that you would treat this if you have this reaction is usually by antihistamines. Hay fever, allergic rhinitis. This is what people typically get when they are exposed to like pollen, for example. Teary eyes, sneezing, runny nose because you've inhaled something. So it's limited to the upper respiratory tract, and then antihistamines also help here. So with hives, the reaction is limited to some skin area like your hand or your chest. With hay fever, it's limited to the upper respiratory tract. That's why these are both localized. And then asthma is when a person's airways become inflamed and narrow and swelled, and they produce a lot of mucus because the mucus is trying to protect you, but then the mucus makes it very hard to breathe. With asthma, antihistamines are not effective. So we see antihistamines help here during these inflammatory reactions, but with asthma, you need something that will dilate your airways. So these are 3 localized type 1 hypersensitivities. Systemic is when the reaction spreads everywhere, which can be very, very dangerous. So this is rare, but it's a serious form of type 1 hypersensitivity, or as we call it, IgE-mediated hypersensitivity. So here the antigen, or whatever the allergen is, actually enters your bloodstream and spreads throughout the body, and it binds to the IgE on the white blood cells, like the method we talked about. Your basophils release all the granules. One of them is histamine, and you get very, very bad, let me go back, very bad blood vessel dilation. Your blood vessels dilate a lot, and this results in a lot of fluid loss, which results in really, really low blood pressure. And this can lead to heart failure, and this is what can lead to anaphylactic shock. Anaphylactic shock is a very dangerous form of allergic reaction where you cannot breathe because your bronchial tubes start getting very constricted. So it's a very dangerous allergic reaction, and it can happen with peanuts, bee stings, penicillin, anything that causes somewhat small allergy reactions can cause major ones. And the way that you control these is by injecting someone with epinephrine. Epinephrine is, a lot of people who have allergies carry an EpiPen with them. That's what an epinephrine is. And epinephrine, basically, if you know someone that has an allergy, you should look for the EpiPen with them because they usually have it, and you just take it out, open it, and you press it on the muscles, typically on their thighs, so that the allergy response can calm down. So that's what anaphylactic shock is. And now when we talk about treatment with type 1 hypersensitivities, a lot of people who have typical allergies take antihistamines. Antihistamine stops histamine from binding to receptors that can trigger these allergy symptoms. And as a lot of you know who take them, this also affects different cells that are important in your sleep cycle. And I will discuss this later, but that's why a lot of antihistamine medication make you sleepy. Bronchodilators for people who have asthma, open airways, especially because the airways are producing so much mucus that it's hard to breathe. And then epinephrine pens, you give them to people to stop muscle constrictions that block the airway so that they can breathe again. And epinephrine is basically adrenaline. It's a hormone. It's the hormone we think of when someone is pumped up and they're ready to do something, their adrenaline gets high. So here you're putting adrenaline in someone. And as a side note, this is also what gets put in someone when they overdose on drugs. So a lot of times, besides the many things that an ambulance will do, they will put adrenaline or an EpiPen in someone that's overdosed to get them to wake up again. So this was type 1 hypersensitivity. So those were different treatments. Prevention, there's a lot of studies on how can you prevent allergies completely. Steroids can reduce inflammation. So steroids like cortisols and hydrocortisone creams you can put. That should have been in the other slides. It's more of a treatment. Prevention is to avoid triggers. So if you want to prevent this response from happening, you would avoid triggers that basically cause your immune system. There's a lot of immune therapy to alter your response. And what immunotherapy is studying or doing is it stimulates another antibody called IgG. And IgG tries to neutralize the antigen that was causing you to have an allergic reaction. So here, if you have here pollen that was giving this person an allergy because she was producing so much IgE that was interacting with the allergen and then releasing histamine from the white blood cells. Well, if you stimulate the body to produce IgG, usually they take it in the form of an injection, the IgG over time will neutralize the antigen, and then the antigen won't have anywhere to bind because it's competing with IgE binding. So you're injecting extremely dilute antigen over time so that the person's body neutralizes it almost. So this is how this one works. And that was type 1 hypersensitivity. So to do a summary of it, it's an immediate IgE mediated hypersensitivity. Usually someone has a very quick response. If someone has an allergy to something, you see the response right away and you need to react right away. The way it's done is IgE binds to white blood cells such as mast cells or basophils. These are the ones it binds to. And then once it's found its antigen, it will cause the basophil or the mast cell to degranulate or release different inflammatory substances such as histamine, which cause inflammation and other things. And examples of this are allergic reactions that are localized. So hives, hay fever, which is basically you breathing in moles and having very bad runny nose, so upper respiratory tract inflammation, asthma. And then if the allergen gets into the blood system, this is where we see a systemic response. So an example of that is anaphylactic shock, which can also happen from foods, bee stings, penicillin. It can be caused by a lot of things. So if asked, where does anaphylactic shock fall into the different hypersensitivities, know that it's type 1 hypersensitivity. So now we're going to talk about type 2 hypersensitivity. And type 2 hypersensitivity, we see it happen with different blood transfusion reactions. So we're going to talk about that. So let's go to type 2 hypersensitivity. So type 2 hypersensitivity has to do with cytotoxic reactions. Remember that cytotoxic T cells are killer cells. And so this is a response that destroys cells. And the response takes hours to days later. It's not like type 1 hypersensitivity. It has to do with the antibodies IgM and IgG. They react with molecules on cell surfaces and they trigger the cell to be destroyed, usually through the complement system. Remember, with the complement system, you create holes in a cell and the cell basically just slices. And this can happen with blood transfusion reactions. I'm saying if you give someone the wrong type of blood, that's why you should give someone the appropriate blood type. This is the reason why, for example, if someone's type A blood, you don't give them type B blood, because this is what their body will do. And then hemolytic disease of the newborn, we're going to talk about that. That falls into type 2 hypersensitivity, as well as autoimmune diseases. So with blood transfusion reactions occur when your body's antibodies start targeting antigens on transfused blood. This is why you have to make sure that the blood you give someone, if you're giving someone blood, matches what they are able to take. So your red blood cells, called erythrocytes, have surface antigens. So if you're type A blood, your body makes A antigen. If you have type B blood, you make B antigen. If you have AB blood, you make A and B antigen. And type 0 red blood cells or erythrocytes make no antigens. Now, your body makes natural antibodies for whatever antigens it does not have. So if you're type A blood, you make A antigen, but you also make B antibody. So you're not going to make antibody that's going to target your own cells. Otherwise, you would harm yourself. But you make antibodies to target anything that's not your own blood type. So if someone is type O blood, they make antibodies against everything, against type A blood, type B blood, and if you make it against type A and type B, you make it against type AB blood as well. So with transfusion reactions, you have to make sure that the donor matches the recipient. Otherwise, you get a bad reaction, and this is fatal. And this type of reaction doesn't need sensitization because the antibodies are made early in infancy. It's not like you have to be exposed to it, such as like with peanuts and strawberries, where your body has to go through the response to make the antibodies. The antibodies were already made early in infancy, so no sensitization is needed. And if you do have antibodies, like if I'm type A blood, actually I am type A blood, I have type B antibodies. If you give me type B blood, my antibodies will target the type B blood. This will lead to clumping of the red blood cells and death. So this is why it's bad. And the prevention is give the appropriate red blood cell type. So just to give an overview of different red blood cells, type A blood make B antibodies. You make antibodies for whatever you are not. Type B blood makes A antibodies. AB blood doesn't make any antibodies. Otherwise, they would target their own cells. Type O blood makes antibodies for type A and type B. So type A blood can receive A blood and O blood. O blood is the universal donor because it doesn't have any antigens to stimulate antibodies. Type AB blood can accept blood from anyone. They're the universal acceptor. And so go through each one and make sure it makes sense. Now, besides being AB, or O blood type, there's something called a rhesus factor. We're going to talk about it in the next slide, but most of the population is positive. So this is when you hear someone say like, I'm A positive. A few of the population, about 15%, are Rh negative. So the rhesus factor is a protein found on the surface of red blood cells. If you're Rh positive, you have the Rh blood group. If you're not, you don't. Most people are Rh positive, and so the Rh group is important, especially when you're having a baby. And we're going to discuss this with hemolytic disease of the newborn. So when we say hemo, think of blood. Hemolytic disease is a disease where your own blood cells are attacked, lysis of the blood cells, and it happens in the newborn. So here's what happens. You have a mother who is negative for the rhesus factor, and she has a baby with a father that's positive. There's a potential problem here if the baby's blood is Rh positive. So if an Rh negative mom has an Rh positive baby, this can be a problem because the mom, because she's Rh negative, she produces anti-Rh antibodies after she's been sensitized. So the first baby is fine, but now she has anti-Rh antibodies. If she has a second baby and that baby is Rh positive and the mom is making antibodies, the antibodies will start damaging the baby's red blood cells, and this can lead to death. So here is an image of that. So you have an Rh negative mom. She has a baby with an Rh positive father. And the first baby is Rh positive. So the take home message here is Rh negative mom has an Rh positive baby. Her body during this time of having the first baby is going to produce antibodies. This is the sensitization against the Rh positive um, protein from the baby. But the sensitization time will be sufficient for her to give birth to the baby. So now the mom has the baby. If she gets pregnant again, she has those antibodies. If the second baby is Rh positive, then her antibodies will cross into the fetus and will target the baby's red blood cells, leading to damage. And so this is very bad. So when women are pregnant, they have a blood test, and this is why it's important to learn their blood type. If you're Rh negative and you have not been sensitized, you might get the medicine called Rogam from Rh immunoglobulin. And what this medication does is it stops your antibodies from reacting to a baby's Rh positive cells. So it's a very important medication. And remember here, it's the second baby that's affected, not the first, because sensitization antibodies have to be made. So this was type 2 hypersensitivity, and examples of that were transfusion reactions and Rh incompatibility. And here this had to do with antibodies, IgM and IgG. Now we're going to talk about type 3 hypersensitivity, which an example of an illness that falls into this is glomerulonephritis, which has to do with a type of kidney infection or inflammation. So with type 3 hypersensitivity, this one is where your body forms immune complexes, and these immune complexes go on to damage blood vessels. So this takes hours to days later to see a response. And so these immune complexes are antigen antibody complexes, meaning antigens and antibodies bound to each other. And these complexes will deposit on your blood vessels, and activate the complement system. The complement system can lead to a lot of different issues, but you get a lot of clotting, inflammation, and tissue damage over time. So this is why type 3 hypersensitivity is bad. It's because of these antigen antibody immune complexes that settle on blood vessels, causing a lot of inflammation and tissue damage. And the outcome are blood vessels are damaged, and this can lead to organ failure. So an example of a type of inflammation that happens that's associated with immune complexes is glomerulonephritis. And this happens after untreated strep infections. So if someone has a streptococcus infection, which is a bacterial infection, they may get too much inflammation, and the inflammatory damage happens to the glomeruli, which is a part of your kidneys that filters blood. So if you have an infection with streptococcus bacteria, your body starts producing antibodies to protect you against the bacteria. A lot of immune complexes can form, and if too many of these immune complexes form and they're not functioning properly, you will get this immune complex deposit on the blood vessels in the glomeruli, which are the filtering parts of your kidneys, and this will cause them to get very inflamed, and this is where you get glomerulonephritis. Anything that ends in itis means inflammation. So here in this picture, you have a blood vessel, and you have these antibody antigen complexes, and they're sitting on the wall of the blood vessel. They activate complement, which can lead to tissue damage and cell death. And so this is very bad because now you're causing major inflammation and cell death in the glomeruli. So this was type 3 hypersensitivity, and this one had to do with immune complexes where you have major inflammation because of these antibody antigen complexes settling on blood vessels. The last hypersensitivity is type 4 hypersensitivity. This is the opposite of type 1 hypersensitivity. This is a delayed cell-mediated hypersensitivity because it takes a while to see a response, and it's due to specific T cell responses. So these responses, the type 4 hypersensitivity has to do with T cells. This does not have to do with antibodies like the other ones. And so these T cells will form, and these T cells will activate macrophages and killer T cells. Macrophages will cause a lot of inflammation in the body. Killer T cells will start killing different cells, and you get tissue damage because of these activated macrophages and killer T cells. And this hypersensitivity takes days to happen. And we're going to talk about different examples of this. So delayed hypersensitivity reaction, or delayed cell-mediated. An example of type 4 hypersensitivity is allergic contact dermatitis. This is an example of type 4 hypersensitivity. So this is caused by effector T cells responding to small molecules and different chemicals that you put on your skin. So it's contact dermatitis. Derma has to do with your skin. It's inflammation, itis on your skin. And so this can be caused by poison oak, metal jewelry. A lot of the nickel that you see in jewelry can cause, a lot of the people who wear jewelry that has nickel will tell you they'll start like itching their ears, or it causes this itch a lot of times, and it's because of type 4 hypersensitivity. It's because these T cells are responding to these chemicals. Latex allergy is the same things, different cosmetics, makeup products. So it results on a rash on your body, potentially blisters as well. The way you calm this down is you put hydrocortisone cream, which is a steroid that stops inflammation. You could also take antihistamines such as Benadryl, and you avoid the allergen. I can't wear any jewelry that has nickel in it. If I wear earrings with nickel in them, 2 days later or a day later, I start itching my ears like crazy, and they become very inflamed. So the way to calm it down is to put some hydrocortisone cream. So this is allergic contact dermatitis. The tuberculosis skin test is an example of a type 4 hypersensitivity. Typically with this test, you get injected with it, and then you read the test 2 days later to see if someone is positive or not for TB. And type 4 hypersensitivity is also where organ transplant rejection occurs. That's why you have to make sure to give someone a match when you are doing organ transplant. And we also use immunosuppressant drugs sometimes so that the immune system can calm down to accept the organ, and you're not having this major response by T cells. So here's allergic contact dermatitis. So for example, if you have poison ivy or nickel in jewelry or latex gloves, which a lot of people are allergic to, it will cause your T cells. So T cells will become sensitized. They'll create T memory cells. Those T memory cells will go on and activate macrophages and other cells. Macrophages cause a lot of inflammation, and you will from now on have these memory cells to respond to whatever it is, whatever the allergen is. So you get helper T cells activating cytotoxic T cells, macrophages, all this stuff. So this was type 4 hypersensitivity. This was the last one. It was a delayed response, and contact dermatitis is an example. Rejection of transplanted tissues and some chronic diseases like the TB test. Also, when we test for that, that's a type of delayed hypersensitivity response. So these were the 4 types. Take time reviewing them and understanding them. These are usually asked a lot during medical exams, so just be aware of that for a few of you who decide not to go to nursing school and go to medical school. Next, we're going to talk about autoimmune diseases. So with autoimmune diseases, this is when your immune system starts attacking its own self. That's why it's called autoimmune diseases. And it's because your body loses the ability to discriminate your cells from foreign cells. So we call this loss of self-tolerance. So this is when your immune system recognizes its own antigens, its own body as an antigen, starts producing antibodies against its own tissues, or activating T cells that cause major inflammation. So body sees itself as foreign, leading to damage of those organs. And again, this is due to loss of self-tolerance. This is a big area of research. Why does this happen? Why some people are born with autoimmune diseases, some people at a random age, some people are like 30 years old randomly have an autoimmune disease that they don't know why did it develop. Why all of a sudden your body started to decide that it's going to attack its own intestines, for example, with Crohn's disease or other diseases. So your body creates antibodies and immune cells and starts to attack its own tissues. There are many examples of autoimmune diseases. We're going to focus on talking about 3, but just know there's a lot of different examples. And this could be localized or widespread. This could be a rash that you're getting where your body's attacking your own skin cells. Like with a lot of times with lupus and other diseases, you see a significant like rash look, and or it could be widespread where it starts affecting your whole body, a lot of tissues in the body. So we're going to talk about rheumatoid arthritis, type 1 diabetes, and multiple sclerosis. All of these are examples of autoimmune diseases. So with rheumatoid arthritis is where immune complexes form in the joints. So you guys know this, arthritis affects joints typically. And the reason it does is because all these immune complexes, antigen antibody complexes, form in the joints, and then you get major inflammation in the joints. It also has to do with T cells, and they target different connective tissue in the joints, and it's a chronic inflammatory disorder that could happen anywhere in the joints in the body, and it's basically immune complexes targeting joints, and it's very painful. Type 1 diabetes, this is also called insulin-dependent diabetes. It's when T cells destroy insulin-secreting cells. So your body's, the function of the pancreas is to produce insulin. In people who have type 1 diabetes, their cytotoxic T cells start destroying different cells of the pancreas that produce insulin. Therefore, they can no longer produce insulin. Insulin helps your cells take up glucose or sugar from the blood. If you don't have it, you have a high amount of glucose in your blood not getting into your cells, which can lead to many different bad things. So scientists are not sure why the immune system starts seeing these insulin producing cells as foreign, but it does, and it leads to high blood glucose. The treatment for this is you give someone what they're lacking, you give them insulin because their body cannot make it. And then another autoimmune disease we're going to talk about is multiple sclerosis. Multiple sclerosis is when the immune system cells start eating away at the myelin sheath, or the covering, the protective covering that covers your nerves. Your nerves are covered by a layer which is called myelin, and this helps protect them in different ways. All the anatomy people, you guys know this in class. So with MS, your immune system cells start targeting out this protective covering, and this can lead to many different symptoms. So with MS, it can quickly progress into a lot of different things. You can think about how much you would be affected if various nerves are affected. So with treatment of autoimmune diseases, we want to try to calm down the immune system because the immune system is really targeting itself too much. The problem with this is if you have an autoimmune disease, a lot of times people with autoimmune disease take immunosuppressant drugs. The problem with immunosuppressant drugs is they suppress your immune system overall, so you become very prone to a lot of other things. So a common cold, if someone has an autoimmune disease, a common cold with them could take much longer to cure than someone who did not have an autoimmune disease. So just know that a lot of times they take immunosuppressant drugs and a lot of anti-inflammatory drugs, a lot of steroids, a lot of cortisone to calm down all the inflammation that's causing all the pain, whether that inflammation is in your intestines with Crohn's disease or on your skin, anywhere. They take a lot of anti-inflammatory medication. And remember, inflammation is a good thing too. Too much inflammation is bad, but you're also making yourself more prone for other diseases. So it's a very tough issue, but the treatment, you do need these drugs. Another type of treatment is just giving the person what they're lacking. So with type 1 diabetes, the immune system targets the cells that produce insulin. And so the person's problem is not having insulin. So replacement therapy, give them insulin, what they're lacking. Finally, the last class of immunologic disorders we're going to talk about are immune deficiency disorders. This is the exact opposite of autoimmune disorders. So autoimmune is when we have like too much immune system attacking its own cells. Immune deficiency is when you're lacking a fully functioning immune system. So with immune deficiency disorders, there's primary immune deficiency disorders and secondary immune deficiency disorders. So this is when a few or all components of the immune system are lacking. And if you do not have a fully functioning immune system, you're very susceptible to infections. So the types of immunodeficiencies, there's primary immunodeficiencies. This is when you're born with an immunodeficiency. They result from genetic or developmental abnormalities. Secondary immunodeficiencies are immunodeficiencies that develop during a person's lifetime. And you can develop a secondary immunodeficiency by so many different things. So if you take immunosuppressive drugs, radiation therapy, a lot of people who have cancer and do radiation therapy, chemotherapy for cancer, have secondary immunodeficiencies because these drugs really eat away at your immune system. If you lose your spleen, for example, remember the spleen is part of the lymphatic system. It's a lymphatic organ. And with lymphatic organs in the lymph, we see a lot of lymphocytes. So where B cells and T cells. So if you lose that, that is a secondary immunodeficiency. Pregnancy makes you immunodeficient as well. Infections such as HIV lead to AIDS. So just know that the main thing is primary immunodeficiency, you're born with it. Secondary immunodeficiencies are a result of something that happens in your lifetime. So an example that there's different examples for each, but one example I'm going to focus on with primary immunodeficiency is SCID, which stands for severe combined immunodeficiency. And it's exactly what the disease is. It's a severe immunodeficiency loss. It basically means that you have no immune system. This is the whole idea with the bubble boy disease or the bubble boy film that we were supposed to watch in lab. So there's so individuals that have SCID have a defect in their bone marrow stem cells. Remember, in the bone marrow, this is where blood cells are formed. And so if you have a deficiency of B cells and T cells, this can be very fatal to someone. And this is inherited because it's a primary immunodeficiency. You get very severe infections, and the way to treat it is to give someone a bone marrow and fetal thymus transplant. Remember, the thymus are where T cells mature. So this is where we do transplants with bone marrow. You give them what this person is lacking. And during David Vedder's time, he's a boy in the Bubble Boy documentary. So this boy, they kept him in a bubble because you had to protect him against anything because he had no immune system. A cold sore could be deadly. And after him, we learned a lot. Researchers, scientists, doctors learned a lot about SCID, and it helped them develop a lot of different things that we could use with it. And gene therapy is showing a lot of promise with individuals with SCID. An example of a secondary immune deficiency is HIV, which causes AIDS, acquired immunodeficiency syndrome. So HIV, you get it through your lifetime. That's why it's a secondary immunodeficiency. And HIV with time starts eating away at white blood cells. Remember, it attacks T cells specifically. And once you've lost a certain number of white blood cells, that's when we say that the person lacks an immune system. So it becomes the disease AIDS, acquired immunodeficiency syndrome. And then I also put this picture here to also remind you guys that typically people with cancer, different cancers, also have secondary immunodeficiencies. So to sum up this lecture, we talked about the 4 different hypersensitivities. So type 1, type 2, type 3, type 4. Know the examples that fall in each. The characteristics of autoimmune diseases. So autoimmune diseases are when your body loses the ability to tolerate itself, self-tolerance, and it starts attacking its own tissues. Immune deficiency disorders is when you lack a proper immune system. And then we ended up talking about primary and secondary immune deficiencies. So that's it for the lecture, and I hope you guys take time understanding everything, especially the hypersensitivities. So good luck with that.